I'm Natalie, and I'm the health promotion planner for the oral health services here at Thunder Bay and District Health Unit.
And I'm Christine. I'm a registered dental hygienist at the Thunder Bay District Health Unit in Thunder Bay.
Yeah, and today we're going to chat with you guys a bit about the OSDCP, so the Ontario Seniors Dental Care Program, as well as some more general health info around oral health and seniors. Christine's just going to start us off here.
So what is oral health? So oral health involves the health of our oral cavity, most commonly known as our mouth. This includes our dental health, the health of our teeth and gums, and your teeth are part of your digestive system. So they help break down our foods before we swallow, and most humans have 32 teeth, although some of us will have fewer. Just a little bit of anatomy of our teeth. So we have the crown of the tooth. This is the part of the tooth that you see. It's the portion above your gums. And then you also have the root. This is the part of the tooth that holds it into your jaw. It's the anchor of your tooth. So if you want to think of it, it's kind of like a tree. The roots of the tree keep it anchored. And this is the same with your tooth. Typically, you wouldn't see the root of the tooth because it's covered by your gums. And then just to go a little bit more into depth about the anatomy of our teeth, you have your enamel, which is the outer layer of the tooth. This is the part that shields your teeth from cavities and any bacteria. It's the hardest substance in your body. And then just under your enamel would be the dentin. This is not as strong as enamel and is more of a yellowish color. And then you have the pulp. That's the innermost part of your tooth, and that would contain all your nerves, the blood, and the connective tissue. And that's the part of the tooth that, if you were having, say, a toothache, would be the part that's bothering you. So let's go a little bit over healthy teeth. So what should healthy teeth be? They should be free from cavities, they should be clean, they should be firm and intact, and you should be free of pain. What maybe shouldn't be healthy teeth? Loose or chipped, fillings that are loose or sharp, and having pain in your mouth. Now, another important part is what are healthy gums? They should be pink, firm, free from pain, and we hope that they're not red, loose, bleeding, painful, or overgrown. And then for anybody that has dentures, what we hope is that they fit you well. So they should be comfortable, help you talk and chew, and help you smile. And they shouldn't be causing any pain or swelling, be loose, or have any effect on the way that you talk. So now we'll get into why is oral health important, and Natalie will take over.
Okay, so yeah, now that we know a little bit more about the basics of oral health, let's talk about why it's important to us. So overall, this is the system that allows us to chew, to speak, and to smile. So of course, it's important to us. And even more so, poor oral health itself leads to common oral health diseases. And this includes tooth decay, cavities, tooth loss, gum disease, as well as oral cancer, all things you've likely heard of before. But even more than that, poor oral health can wreak havoc on your system as a whole. So for instance, research has correlated poor oral health with many chronic diseases. So if you have poor oral health, you're more likely to also have heart disease, to have bacterial pneumonia, to develop diabetes, as well as certain types of cancer. Poor oral health also, unfortunately, has a negative impact on your nutrition. So of course, if you have pain or infection in your mouth, or if you have tooth loss or decay, you're not going to be able to consume whole foods as well as you usually would be, and then that could lead to malnutrition. It's also been shown to decrease quality of life, as well as to increase your risk of mental health disorders. And in seniors specifically, several studies have shown an increased mortality risk if you have poor oral health. And then lastly, this one's a bit newer, but I found it really interesting. There are studies linking poor oral health with poor gut health as well, and that's because bacteria from your mouth can travel throughout your body and can then impact your gut microbiota. So in a more general sense, what we're seeing is that if you have good oral health, you're more likely to have good oral health. So it really is the entryway to the rest of your system. That's kind of applicable to everyone, but there are particular things that are important to oral health in getting older. So for instance, older adults 65 and up do suffer higher rates than any other age group of gum disease, of dental decay, of oral cancer, of mouth infections, and of tooth loss. In fact, 20% of adults 65 and up have been shown to have untreated tooth decay, while about 68% of adults 65 and up have been shown to have gum disease. So as we can see from the stats, obviously oral health tends to get poorer with time and with age. And so let's talk about maybe some of the reasons why this is happening. So overall, yes, our teeth are amazingly strong. In fact, your molars can bear down with over 200 pounds of pressure. That being said, they're not indestructible, and as we age, our teeth start to undergo changes. So some of the changes that all of us will experience over time is wear and tear of our enamel, which makes us more susceptible to decay. Nerves at the tooth's core lose sensitivity with age. And so the problem with this is that if you have less sensitivity in your teeth, it might take you longer to notice infection, and so it might be further along by the time it gets treated. Additionally, you may have outdated fillings from childhood that start to break down because there has been a change in the materials that are used for fillings over the years. And then lastly, our gum tissue naturally recedes with age, and then our roots are exposed. An additional variable that is connected to seniors and oral health specifically is the relationship between chronic diseases as risk factors for poor oral health. So earlier we talked about how having poor oral health can actually make you more likely to develop diabetes and heart disease and other chronic diseases, but that relationship actually works the other way as well, wherein if you have some of these diseases, you're also more likely to then have poor oral health. Some of these diseases that negatively impact our poor oral health include diabetes, respiratory diseases such as asthma and COPD, osteoporosis, which actually breaks down the jawbone and then shifts the alignment of your teeth, and cognitive decline as well, so such as dementia and Alzheimer's, because as cognitive decline progresses, we might be less likely to take good care of our teeth. An additional variable that has been found to impact seniors' oral health specifically is dry mouth. So seniors do suffer more commonly from dry mouth. This is for a variety of reasons. One is that as we age, we tend to be on more medication, and a side effect of hundreds upon hundreds of medications is dry mouth. And then a secondary reason is that our salivary gland releases less saliva over time, so our mouth just naturally does become drier. And the issue with this is that dry mouth puts you at risk for gum disease and tooth decay. Some other things that might impact your oral health as you get older is we may struggle more so with our mobility and our dexterity, and that might make it difficult to brush and floss our teeth properly and to reach all surfaces. We might have impaired vision. It tends to decrease over time, and it makes it more likely for us to miss spots while we are brushing and flossing our teeth. Social isolation has also been found to be a variable that influences seniors' oral health. The increased social isolation, sometimes experienced as we get older, can lead to depression, and that in turn can impact our oral hygiene habits and our oral health overall. So because this presentation is specific to Thunder Bay, we also wanted to include some data that we gathered locally. And so what we found for Thunder Bay and seniors' oral health, we actually ran a survey with around 2,000 seniors in 2019 to see what oral health looked like in our area for seniors. And what we found was that seniors living in Thunder Bay tend to access dental care less frequently on average. They brush their teeth less often. They're more likely to have recently had oral or facial pain, and they were more likely to visit the emergency department for oral health issues compared to an Ontario average. We also found that the top reported impacts of dental health issues by local seniors was having difficulty eating, so the nutrition piece that we talked about a bit before, and also a negative impact on their personal self-esteem. So oral health is a big problem all over Ontario that needs to be addressed, but it seems like it's even more so an issue up here in Northern Ontario. Okay, so we talked about kind of the negative pieces of oral health as you age, but let's talk about how you can maybe mitigate some of those effects by maintaining good oral health.
Okay, So how are we going to maintain our good oral health? So tip number 1, we want to build a good oral hygiene routine. So the first thing we want to do is brushing our teeth for 2 minutes, 2 times a day, and we want to use a fluoridated toothpaste. We suggest the fluoridated toothpaste, especially in Thunder Bay, because we don't have fluoride in our water. Other places in Ontario I know do, but definitely in our area, that is a big thing for us, is to use a fluoridated toothpaste. And we want to remember when we are brushing our teeth 2 times a day for 2 minutes is that we want to reach the back, the inside surfaces, the teeth, and always along the gum line, because that is a lot of areas that individuals will miss. The next thing we want to do is we want to floss 1 time a day, or floss in between your teeth. You miss 35% of your teeth when you skip flossing. Also understanding that flossing isn't for everybody. It can be challenging. So if we can't floss, then using another tool that would clean in between your teeth, may that be soft picks or a proxy brush, or even some individuals use water picks. But somewhere to clean in between your teeth, because like we said again, 35% of your teeth are missed when you don't do that. And then not forgetting your tongue. That's also important to clean your tongue using a toothbrush or a tongue scraper, and using a mouthwash 1 time a day. We do recommend using an alcohol-free mouthwash. As we did discuss before, dry mouth is a very common thing in individuals, so using an alcohol-free mouthwash will help with that, as alcohol is known to dry out the mouth more. Tip number 2, replacing your toothbrush every 3 months. So we all know bacteria loves to grow on a moist surface over time, so leaving your toothbrush usually wet after we use it, the bacteria will grow on it, so we do recommend replacing your toothbrush every 3 months. Also, we want to replace your toothbrush when you start to see the bristles are pointing in the wrong direction or becoming worn down or frayed, and also after being sick. It's the good idea once, if you have been sick, to get rid of that toothbrush and start fresh with a new one, because our germs will continue to stay on that toothbrush. Number 3, explore toothbrush modifications. These toothbrush modifications can be made to help with toothbrushing ability for those with a reduced dexterity, and it will help us remove the plaque in the places that maybe we can't reach or are having trouble manipulating that toothbrush. So you can always use a double-headed toothbrush. Electric toothbrushes are great because they have a bigger handle, and they also will spin for you. Using a longer end or wider handle, you can get extra grips, like say like a bicycle grip or a sponge, and add that to your toothbrush. And always making sure to use the softest bristles. A soft toothbrush is best. Tip number 4, rinsing with water after we eat. This is an easy, important one, is rinsing after eating will help dislodge leftover food particles. When we're out and about and we eat, we can't always brush right after, so even if we rinse our mouth with water, it will help neutralize our mouth and rinse away any food particles and just stir up that bacteria in our mouth. You could also chew sugarless gum too. That is also a helpful thing, but even if we always have water and rinsing, that's a great tip to have. Tip number 5, be aware of poor oral health risk factors. So we know there is some risk factors out there that can affect our oral health. So daily use of alcohol, smoking or vaping, these can all lead to dry mouth over time, inflammation, enamel damage, and it can also put you at a risk for oral cancer. So just making sure that we are aware of some of the habits we might have and the risks that it puts on our oral health. Number 6, scheduling regular checkups and cleanings. So surveys actually show that 1/4 of adults 65 have not seen a dentist within the past 5 years. So just remembering to book that appointment with your dentist or your dental hygienist, your oral health care provider. When you do book that appointment, make sure you let your oral health provider know about any health conditions you have or medications you're taking, because they will help you be aware of any of those that may have a poor outcome on your oral health. And tip number 7, taking care of dentures. So if you have dentures, it's also important to take care of those. as well. So cleaning them at least once a day. Removing them at night is a big thing. We want to give your tissues the time to breathe. So always remember to take them out at night, soak them in cleanser overnight, and clean them up, then continuing to take care of your mouth as a whole. So people who have complete or partial dentures can still get gum disease. So you always want to do checks of our gums and making sure that you don't see any weird bumps or any sores. And if you do, you want to see your healthcare provider, or you want to see a denturist to help you get a better fit. Tip number 8, avoiding sugar. We all know that we love sugar. It's a hard one to avoid, but sugar is the #1 cause of tooth decay, so avoid it when possible. Everything in moderation. If you're going to have sweets, try to have it alongside with meals because there is more saliva production. Also, having the sweets with your meals will help neutralize things in your mouth. So we're not saying you can't have it. We're just saying if you are going to have it, try to limit it or have it with meals just to help your mouth out. Tip number 9, make water your beverage of choice. Staying hydrated with water is the best way to keep your mouth moisturized. It neutralizes any of the acid. It washes away debris for food and beverages, and it just overall helps our mouth out. Carbonated and sugary beverages can lead to tooth decay, so if you're going to choose a drink of choice, we always suggest water is best. Number 10, avoiding acidic foods. Acidic foods actually can dissolve the protective enamel around your teeth, so anything that has citrus, carbonated beverages, coffee, this all has acidity to it, and this will actually attack your teeth. So this can lead to tooth erosion and sensitivity. So rinsing your mouth with water after eating will dilute the acid in your mouth. And then we also suggest waiting at least 30 minutes before brushing your teeth after having something acidic because it will give your enamel time to resettle. Another thing you can have is eating cheese after having fruit. It will actually help neutralize the pH level in your mouth as well. And then another little tip is if you are going to have something acidic to drink, using a straw is also very helpful. And then tip number 11, picking oral health foods that are friendly. So without the right nutrients, your teeth and gums can be more susceptible to decaying gum disease. So some suggestions for oral health friendly foods, like crisp vegetables and fruits, so like apples, carrots, celery. Cheese is a very oral health friendly food, nuts, and yogurt. And then just a little bit more in depth about friendly foods, we want to talk about the vitamins. So without the right nutrients, your teeth and gums, again, can become susceptible to decay and gum disease. So calcium is very important for us. It protects and strengthens the enamel on the outside of your teeth. Calcium is in your saliva, and it can help repair the places acid may have damaged. The next one is vitamin D. This vitamin D plays a vital role in our bone and tooth mineralization. It actually helps the calcium absorb, and it's essential for the healthy teeth and gums. Then we have phosphorus, which is also a natural protectant for our teeth and will also help rebuild your enamel. And we have vitamin C. Vitamin C will strengthen your teeth alongside the rest of your body. It helps keep the connective tissue in your gums healthy and strong. So those are all tips to kind of keep your oral health nice and healthy and things that we want to try to do daily. Now we're going to get into what the Ontario Seniors Dental Care Program is and what services we all have to offer.
So I just want to preface by saying, like we said, we're with the Thunder Bay and District Health Unit. So we're looking to increase local uptake of this program within our health unit and get the word out to our seniors. That being said, this is a provincial program that we're going to talk about. So if you're not from Thunder Bay, I welcome you or encourage you to look up your own local health unit and see if they offer this program as well, if you feel that you're eligible. Yeah. So what is the OSDCP? So the Ontario Seniors Dental Care Program, or short form OSDCP, is a provincial government-funded dental care program that provides free routine dental services specifically for low-income seniors that qualify for the program. So we'll talk in a minute about what those qualifications are and what makes you eligible. So here are the services themselves that are covered by the program if you are eligible for it. It covers cleanings, gum disease treatment, crowns, oral surgery in some instances, assessments, root canals, x-rays, as well as dentures. So who is eligible for the OSDCP? Well, there's 4 pieces of criteria. The first one being you are 65 years or older. The second one being you are a resident of Ontario. The third one, you have no access to any other dental benefits at this time. And then lastly, there is a financial aspect to it. So you have an annual net income of $22,200 or less if you are an individual, or if you're a couple, you have an annual income level of $37,100 or less. So if you or someone you know you think fits these 4 pieces of criteria, then you would be eligible for the OSDCP and you could get free dental care as a senior. If you think you are eligible or someone you know is eligible, this is how you go about applying. So there's a couple different options. You can apply directly online by going to the Ontario website. You can apply by mail, by printing the application form, filling it out, and mailing your application. Or if you are within the Thunder Bay District area, feel free to come visit us here and you can pick up an application and we will support you in completing the application, filling it out, and mailing it. And in fact, we actually have a newly renovated dental clinic right here in the health unit that we use to provide a lot of these services. We have registered dental hygienists like Justine, dental health educators, and dentists on file here as well. So you can receive your care directly here from our team. Yeah, so that's everything we have for you today. I hope there's at least some grain of oral health information that you were able to pull from this that's applicable to you or someone you know.